My first experience with transgender surgery was when a local psychiatrist referred a patient to me about 1 year into practice. I was a young surgeon just starting out in practice, and I remember Dr. Martin Goldstein sent me a patient who was a female-to-male trans guy who was already on hormones, living full-time as a guy, and wanted to have the bottom surgery done. I recommended that he find somebody who did the surgery. He said, "No, you have a good reputation. I want you to do it for me. Can you find out how to do it?" I said, "Well, give me a couple of weeks." I did a lot of reading, and I found a technique that I thought I could do without any trouble, and because I already had a large amount of training in heavy reconstructive procedures. In any case, we did the operation. It was a great success, and I'm still in touch with that patient. I did that patient about 35 years ago. Happy story, got married, has 2 grown children now, very happy story, lives in Florida. I didn't do anything after that. No one sent me patients to do. I didn't know anything at all about the transgender world. I didn't go to meetings. I had no idea about the whole transgender community. And I thought also that if I developed a reputation as Philadelphia's sex change doctor, maybe people wouldn't come to me for facelifts and nose jobs and liposuction and all the other things that plastic surgeons do. So I didn't really pursue it or look into it. So many years went by. I did a lot of reconstruction and accidents and burns and hand surgery, and gradually I did more and more cosmetic or aesthetic surgery. Until about 6 years ago, a young surgery resident came to me who was just finishing general surgery. Her name was Christine McGinn. And she wanted to apply to my residency training program in plastic surgery. I said, "What do you want to be a plastic surgeon for?" She said, so I can have the plastic surgical skills to do high quality transgender surgery. I want to devote my life to transgender surgery. "And why do you want to do that?" "Well," she said, "because I'm trans. I'm a trans girl." She's a beautiful blonde. She actually was a student at our medical school when she was a guy in guy mode, and now she had transitioned, and she was finishing a general surgery training program as a female, and she wanted to do plastic surgery. Well, we took her into the program because she was a good resident. And she said to me, "Dr. Leis," she said, "you're a great surgeon and you have a great experience. How come you're not doing transgender surgery?" I said, well, I told her the story that I had done some years before, but never just followed through with it. She says, "You should really think about doing transgender surgery because you could be a great resource to our community. We need more high-level surgeons that can help us. There are very few surgeons in the United States that do the surgery. There are 1 million people doing cosmetic surgery, but very few do transgender surgery. And a lot of people go out of the country altogether to have it done, to save money, or just because they can't get on someone's list." So I started to think about it more and more. A couple weeks later, Marcy Bowers, Dr. Marcy Bowers, who was in Colorado, came to Philadelphia, actually with the idea of influencing me to take Christine into my residency program so that she could get trained in plastic surgery, because I think Marcy wanted her to join her in Colorado where she was practicing at the time. So in any case, she said, "Why don't you come out? I hear you're thinking about, you've done it a little bit before, and I hear you're thinking about maybe starting again. Why don't you come out and spend a few days with me or a week with me to see what it's like? Maybe I'll decide to do it again." So I said, "Well, I'm not sure if I do, but I would be interested to come out and see what you're doing." So I did. I made a trip to Colorado. I spent a week with Marcy Bowers. She's a lovely, lovely woman and a good doctor. And I saw the procedures that she did, and I have a lot of training and experience in surgery, so I thought, well, I could do that. Technically, it wouldn't be a problem for me. And so I came back and decided to get involved in the trans community. I started going to transgender meetings. I created a website. I started giving lectures at the trans meetings, and now I'm a fixture at all the major trans meetings in the country. I give lectures and seminars and workshops. I do consultations almost from the minute I arrive to the minute I leave those centers. In a couple of weeks, I'm going off to Boston for the first event. And I think I'm one of the major players in the transgender world now. I think we do very high quality surgery. People are coming from all over the United States, and I have a lot of very happy patients.